It was just a workout until he passed out. Heat illnesses can be life-threatening. From heat cramps, heat syncope, heat exhaustion, and heat stroke, I'm going to explain the difference. Normally, your body is thermoregulating, which means it's regulating its own body temperature and keeping you cool. In times of appropriate hydration, the body will redirect blood flow to the skin to help dissipate excess heat. But when this process is impaired due to a number of mechanisms, including being too hot outside, the body will suffer. We'll start off with heat cramps, which are more likely in the calves, the thighs, and the shoulders. Usually this can occur in a heavy and extreme workout, whether it's outdoors or even indoors. If this is happening to you, stop, rest, and hydrate. Then we have heat syncope, which basically means they fainted. So think of those individuals that are out there gardening and they get a little lightheaded every time they stand up from a stooped position, and they're also feeling weak. They may or may not have cramps. Usually these people don't. The temperature will go up, but it usually stays below 104. Move the individual to a cool environment. Now we have heat exhaustion. This is even worse. You may or may not have all of the above, but in addition to having a failure to sweat, there are GI side effects such as nausea and vomiting. Often the patients may or may not need IV fluids, so they need to be taken to the ER. Then we've got heat stroke. This is the worst kind. So you have everything from above. You may or may not have the cramps. You may or may not have the fainting, but there are mental status changes, confusion. Irritability is another one which people are often surprised. But there can be seizures and even coma. Sometimes these symptoms mimic a stroke. That's why people think of stroke first. You've got to call 911, and while you're waiting for the EMS to show up, move the patient to a cool environment and actively cool them. If you are elderly, you have chronic medical conditions, you are at risk. And contrary to what people think, alcohol and caffeinated beverages are going to dehydrate, even if they are cold. If you like this content, follow me, subscribe, and I'm here to make medicine make sense.